I think the specialty in medicine that we pick often is personality related. Certain personalities prefer certain specialties because that's the way that specialty works. Emergency medicine does provide some unique things. You have to be able to multitask and enjoy doing it. You have to enjoy being a little bit of a detective because you get the first crack at things, okay? You have to be willing to interact with people and know how to talk to many different people and get them to talk to you, because you have to establish trust in a very short period of time so you can get them to tell you all the things that they need to tell you so you can fix them. I believe one of the other things that's very attractive about emergency medicine is if you like to use your hands, there's a lot of procedures. Same with trauma. You have the opportunity to fix some things right there. And emergency medicine physicians are able to, when you're at work, you work hard, and not necessarily in the military, but in the civilian world, when you're finished with your shift, you go home and you're off. And so it's a bit different than thinking of the physician who has the pager on their belt walking around getting paged at 2 in the morning for their patient that is in the hospital. You may work a bunch of nights in the ER, but when you're not working, you're not on call. Once again, military is different, but I think all those things put together are why emergency medicine has grown to become one of the more popular specialties in medicine. We have a lot of resiliency programs that are provided here within the military. Each individual is a little different. Clearly some people don't enjoy the emergency environment, don't like a lot of blood or screaming or other things that can come along with it. And so each person has to deal with it in their own way, but there are many resources provided both from the military and other hospitals to do that. Once again, I think a lot of it is personality driven, and if you have the right personality where it fits, then you just learn how to cope with it effectively. If not, you usually don't do it for long. We are fortunate to have the largest emergency medicine training program in the entire Department of Defense, and one of the largest and oldest in the entire country, civilian included. We have 16 residents a year, so 48 total residents at a time, based on year of training. And so we are the largest provider of emergency medicine physicians to the Air Force and Army. We're very fortunate to have a very robust program here with lots of research and lots of phenomenal residents. We also have ultrasound fellowship. We have toxicologists here. We do emergency medical services fellowship, and we have an outstanding emergency medicine physician assistance fellowship as well. So, and the critical care nurse as well, emergency nursing. So we have at least 5 separate emergency training platforms here. And that's wonderful because we have a chance to truly impact and then spread and share the information. It is because those people that we train today come back in 5 and 8 and 10 years and are then the leaders of medicine, and many go out after their time and then are in the community providing care all over the country. One of the most incredible things is over the past several years we have a once annual field training. Right before they graduate, the graduating seniors, we take them out to Camp Bullis, and we bring in Air Force aircraft, planes, we bring in helicopters from Army, they come out from Fort Hood. We work with a Special Forces training group, and we actually take them through 2.5 days of as real as you can get short of being deployed, where they're taking care of injured and full battle rattle, getting them evacuated on vehicles and helicopters, and then providing care. And we take them through this, and we exhaust them, and we train them, and we evaluate them. And so that has been built, and this coming year will be the 4th annual iteration of it, where we, like I said, we involve all 3 services. But this past year, the Navy came and played with us as well, and so just because they had to fly themselves in from the West Coast. So it was great. So we had almost 30 trainees who were about to finish their emergency medicine training and go out all over the world, and we were able to give them just a great simulation. And the physicians and nurses who are out there training and evaluating them have all been all over the world, downrange, special operations, with a wealth of experience. So they are able to not only make it very realistic, but force them to understand the challenge is when you're not in a beautiful air-conditioned facility 24/7.